Hello everyone and welcome. Today we're going to be learning about ulcerative colitis. This is part of the video on inflammatory bowel disease, but just focusing on ulcerative colitis. I hope you enjoy. So let's talk about ulcerative colitis first. So this is an inflammatory bowel disease where inflammation and ulceration of the colon is observed. So if we just pay attention to the name, ulcerative means presence of ulcers. Colitis means inflammation of the colon. This is the large bowel. So we're going to see continuous colonic lesions, meaning it does not affect the small intestine. They are colonic lesions only. There will always be rectal involvement. So obviously, like everything else in medicine, there are always exceptions, but as a rule of thumb, there will always be rectal involvement in ulcerative colitis. So ulcerative colitis will start at the rectum and extends proximally through the colon. So as we can see in this image, we have the rectum here. It's very inflamed, it's red. And the inflammation essentially spreads up throughout the colon, but it would never affect the small bowel or anywhere else in the GI tract. So in terms of the gross morphology, ulcerative colitis will affect the mucosa and submucosa only. So here we have a section through the large bowel, and we can see all the different layers. So here's only the submucosa and the mucosa that are affected in ulcerative colitis. And this is in contrast with Crohn's disease, where we will see a transmural inflammation, so affecting all the layers of the colon. Friable mucosa can be seen in ulcerative colitis. Here we have an image of ulcerative colitis, and in comparison to a healthy bowel. Friable means it will bleed easily. So let's say if we touch the wall here of the bowel, it might start bleeding. In ulcerative colitis, we will see superficial and or deep ulcerations. And another thing we can see in this image, in contrast with this one, is that here we can see all these divisions in the colon. These are called the haustra. So up here as well, various different divisions. These are the haustra. And in ulcerative colitis, you get the loss of these divisions. This is also a characteristic finding of this disease. So like I said, we have loss of haustra, leading to a lead pipe appearance on imaging. So here we have the large bowel, so the descending colon here. You can really see how it just looks like a continuous pipe, like a lead pipe, and there's the loss of haustra. Next, pseudopolyps may be observed. So this is an image of a colon with severe ulcerative colitis, and we can see a lot of these polyps, but they are not true polyps, they are pseudopolyps, because they are caused by the healing of ulcers. So essentially there were many ulcers in this bowel, and as the body heals those ulcers, it will essentially put there a little bit more tissue for some extra protection, and essentially ends up forming these polyps. So microscopic morphology now of ulcerative colitis. We will see crypt, abscesses, and ulcers. So here we have an image of normal bowel. So these crypts are part of the normal bowel. We can see them here. And in ulcerative colitis, because of the extensive inflammation, we have a lot of neutrophils in the area, and they can end up essentially clogging these pits and forming abscesses. So this here is a crypt abscess. And now in a histology slide, what it would look like. So for example, here we have a crypt, and inside a bunch of neutrophils. So this is a crypt abscess. Also, ulcerative colitis is a T helper 2 mediated response, meaning it will produce a humoral immune response. So a humoral immune response is that involving antibodies and complement proteins instead of a cell-mediated response, which is seen in Crohn's disease. So some of the signs and symptoms more specific to ulcerative colitis will be bloody diarrhea, which is the most common sign of ulcerative colitis. There will be varying degrees of abdominal pain depending on the severity of the disease, but left lower quadrant pain is common. So if we look here at the left lower quadrant, this is where the descending colon and the sigmoid colon would sit. And we know these are the areas that are most commonly affected by ulcerative colitis, so you would see left lower quadrant pain quite commonly. You may see nocturnal diarrhea. This is essentially an indication of how bad the diarrhea is. So you can have really bad bloody diarrhea in ulcerative colitis. There can be some mucus discharge from the anal region. Tenesmus, which is the feeling of incomplete emptiness after opening your bowels. There can be weight loss and fever. So here we can have a look at some of the types of ulcerative colitis. It is essentially a classification depending on where the inflammation has spread to. So if the inflammation is just affecting the rectum, it is termed proctitis. Then we have proctosigmoiditis, which is affecting the rectum and the sigmoid colon. Distal colitis, essentially up to the splenic flexure. Extensive colitis, up to the hepatic flexure. And then pancolitis is the whole large bowel. And one thing that we can see in pancolitis, whenever the inflammation involves the cecum here, we may see something called backwash ileitis, which is essentially inflammation of the ileum as well, which is small bowel, due to the close proximity to the inflamed cecum. Next, let's talk about the Truelove and Witt's Severity Index for ulcerative colitis. This is how we're going to classify the disease into mild, moderate, and severe disease. So here are some of the parameters we have a look at. So the amount of bloody stools per day, so if it's less than 4, 4 to 6, or more than 6 bloody stools per day. Pulse, the patient's pulse, the patient's temperature, the patient's hemoglobin. This would essentially indicate as anemia. So if there's extensive bleeding, patient would likely be anemic. Next, we have erythrocyte sedimentation rate and C-reactive protein. These are acute phase reactants. So they are proteins that increase their plasma concentration in response to inflammation. So essentially this would indicate how severe the inflammation is. Now, it is important to establish the severity of ulcerative colitis because it can have some really life-threatening complications. One that we will talk about now is a toxic megacolon. So this is a rare but serious complication of ulcerative colitis, and it happens essentially due to the cessation of colonic contractions. The reason for this is poorly understood. However, it is believed that the overproduction of nitric oxide seen in that severe inflammation essentially inhibits smooth muscle tone, leading to a rapid intestinal dilation. So the walls of your intestine start dilating. This will essentially lead to colon wall thinning, so they will become very thin and are prone to rupture. And here's where we're very worried, because then we're going to have bowel contents all over the peritoneum, This will lead to peritonitis, and the patient can become septic and die. So here we have an image from Radiopedia showing what a toxic megacolon looks like. You can see it's extremely dilated, covering all the abdominal cavity. Let's talk about the extraintestinal manifestations of ulcerative colitis. So first, here are some extraintestinal manifestations common to inflammatory bowel disease, so to both ulcerative colitis and Crohn's disease. So we can have erythema nodosum, which is essentially swollen fat under the skin that will cause bumps and patches that look red or darker than the surrounding skin. We have pyoderma gangrenosum. This is a rare condition that causes large, painful ulcers to develop on your skin, and it is seen most often on patients' legs. And then aphthous ulcers are essentially ulcers who will develop commonly in your mouth. So this is a good examination. It's good to examine patient's mouth when you're suspecting IBD. Some ocular consequences includes episcleritis and uveitis. So that's the inflammation of the episclera and the uvea. The uvea can also be called the iris, so it's the colorful part of your eyes. Some MSK consequences include migratory polyarthritis, which is a condition that affects multiple joints in a progressive manner. So it might migrate from one joint to the other. Then another one is ankylosing spondylitis. This is a condition where you get gradual fusing of the vertebrae, so you lose a lot of mobility there. Now, an extraintestinal manifestation more particular to ulcerative colitis is primary sclerosing cholangitis. This is essentially inflammation of the biliary tree causing scarring of the bile ducts. So here we have an image, and essentially all the bile produced by the liver, right, and the bile stored in the gallbladder, all go through all of these ducts to be excreted into the small intestine. And so if there's inflammation of the biliary tree, the ducts will become hardened and narrow because you get the deposition of fibrous tissue in these ducts. And this essentially increases the pressure in the biliary tree and leads to a backflow of bile into the liver and increased pressure within the sinusoid spaces in the liver, essentially leading to a gradual liver damage. It can be very serious. Now, ulcerative colitis also increases the risk for colorectal carcinoma, and it's something to keep an eye out in patients with IBD. So just as a quick revision of what we talked about in ulcerative colitis, try to remember just ulcers with 3 C's. So U standing for ulcers, L standing for large intestine, so the disease only affects the large intestine when it comes to the GI tract. C meaning continuous, so we have a continuous lesion. Another C for colorectal carcinoma, there's an increased risk of colorectal carcinoma. C for crypt abscesses. E as for extends proximally, so the inflammation will extend proximally throughout the colon. R for red diarrhea or bloody diarrhea. And then S for sclerosing cholangitis, which is that extraintestinal manifestation that we just talked about. So that is it for ulcerative colitis. If you enjoyed this video, don't forget to leave a like and subscribe for more.